Assalamu alaikum. Welcome everyone on board. Uh, Today we will continue our discussion. I will just give you a brief overview about what are main concerns in dental anesthesia. Okay, because there is one component of dental anesthesia, or you can say, which is part of you maxillary surgery. So that is something else. But dental anesthesia, usually there are some group of patients in which we are dealing with dental anesthesia. Actually, you will find some adults having some impacted tooth, wisdom tooth, okay, or like some infected, then in which there is extraction, okay. So this will be one group of patients. Other group of patients will be in adults who are going for valvular heart disease surgery. Okay, valvular heart disease surgery, and before that, they will be at risk of infective endocarditis. So these patients have dental clearance procedure before they proceed for valvular heart disease. Okay, so this will be one group. Then you will have pediatric patients. Okay, so pediatric patients will be mainly with the like there are there will be patients with some uh, like neurological problem like cerebral palsy. Okay, or any patients who have very poor hygiene. Okay, like you will find a lot of patients with some other neurological problem like ADHD. Okay, so these pediatric patients you will see for dental clearance, or you can say dental extraction. Um, so the like general consideration of pediatrics age group will be there. All the pharmacological, physiological, okay, changes, anatomical changes. So like same concern like any pediatric patient. So this will be one concern. Then other important concern in dental anesthesia is nasal intubation. Okay, because in majority of patients they will ask for nasal intubation. So in nasal intubation, you should be think sure that number one, there is no nasal obstruction, because if there is significant nasal obstruction, there is, for example, DNS, okay, there are polyps. So you should be taking good history about any epistaxis, okay, obstruction, and in pediatric age group, especially adenoids, because if you will try to have nasal intubation without proper evaluation, okay, this can create problem for you. This is one thing. Even how good you are, you will have some bleeding. So to minimize, you should use nasal decongestant. Okay, nasal decongestant enough uh, amount and enough time before you try to put the tube. Like then you should be knowing that usually they have like pseudoephedrine like substance, xylometazoline. So these are alpha agonists. So if you are using it in slightly higher dose, it can cause blood pressure, increase in blood pressure and decrease in heart rate. So you should be anticipating or thinking about this thing. Okay, because intraoperatively when they are using for nasal surgery, they are putting adrenaline. So in that case, actually, adrenaline usually may be absorbed in the blood and cause tachycardia. Okay, so this you should be and knowing and anticipating. And similarly, there is a special silicone tube which is recommended for nasal intubation. Okay, but sometimes it's not available. Proper size is not available. So, like people use the normal ventricular tube as well, but it is actually not recommended. So, whenever possible, you should use this silicone tube. And if you are having too much young baby, like actually today I had a list for dental surgery, and actually there was a 7 month baby. It was not a clearly dental procedure was being done by dentist, but it was just some biopsy. There was some growth in the near the mouth and gums, and they need to take some biopsy. So they were asking me for nasal intubation. So if they are like very fussy and they are not understanding the situation, then you might need to try it. But this is a big challenge. Otherwise, another option, practical option, which you can offer, that you can tell that initially, whatever side you want to start with, like for example, they have extraction from both sides. So you can fix the tube either in mid, in the center, or you can put it on one side, opposite side to the procedure, and as soon as they finish their procedure on one side, you can remove the tape and you can put it on the other side. But as in any even tonsil tonsil surgery or anything like that, there are chances the tube can be kinked. Uh, okay, so endotracheal tube can kink, and dislodgement when they are using like when if you have placed there, it can dislodge even in this one nasal intubation as well, because they are doing the surgery in the same place where your airway things are there. But there will be more chances of kinking or dislodgement of tube if you have done the oral endotracheal tube. So you should be very careful about it. You should properly fixed. You should cover the eyes with gauze. Okay, and then usually it is better to have a straight connector. Okay, straight connector, and make a loop in a way, like if for example like silicone tube, it will be coming towards the head side. Okay, so sometimes if you have put directly, maybe it can cause pressure symptoms on the forehead. Okay, because it will be coming through the nasal place. You have placed nasal endotracheal tube, and it is coming to the end, the proximal end. You have to connect with the breathing circuit, and the connector, it will be coming over the forehead. So it is better to have a padding so that it does not cause any pressure symptoms. Okay, so this is some important points with reference to placement of endotracheal tube, concerns with reference to nasal intubation. Then again, when they are placing the retractor, it can cause dental damage, it can cause mucosal damage, it can cause damage to the lips. Okay, so then another important point will be throat pack. So that will be the same concern which is there for any other ENT procedure again, that you should label, inform loudly, throat pack in. You should note down the throat pack in, throat pack out time. Okay, and you should be knowing that throat pack material should be soft, soaked, lubricated. Okay, and you ideally the outer end should be attached to the endotracheal tube or attached to the lips, so that we don't forget it, because there are incidents of like you forget to remove throat pack, and it is causing airway obstruction in the PACU in the recovery. So you should be there will be concerns related to throat pack. You should be very careful about it. Okay. So this is that's it. And then they are using local anesthesia. Okay. So because it's a highly vascularized area, so there will be high absorption. So you should be knowing about it. Usually they are using sometimes mepivacaine. It's not familiar much for us. Even like it's a amide. but I don't recall the physical properties. Recently, mepivacaine, just because I tell you that I have never used mepivacaine, but usually the dentists are using it. And there was, I just heard from one of my dermatologist friend that she was giving Botox injection, and they injected mepivacaine with the epinephrine initially to the not epinephrine, mepivacaine plain. And can you believe this? There was anaphylaxis with mepivacaine. So, with any other local anesthetics and with any medication can cause anaphylaxis, but recently I had this, like you can say, personal uh, experience like that. So, let me show you some of the data and articles with reference to, yes, like pediatric patient, as I discussed before, all the concerns of difficult intubation and difficult IV lines. You have to have difficulty in communication. So you might need to have enzylysis. There are a number of options which you can use. You can have some ketamine. Some people even at times I use this intramuscular ketamine. Okay, with the insulin syringe. Um, uh, so if you give some time, this is one of the option. The other option, there is availability of midazolam or fentanyl or this one, Presidex. They are using it intranasally, orally. Okay. So there are few options for you to have to achieve this endolysis. Mm, you see, you can see this thing that these are the usual, so it can cause, and actually when the patient will wake up, there will be severe pain over here, like in the in the in the cheeks. Okay, so dental anesthesia is performed as day surgery as well. So you should be because this patient can bleed from the dent and then place. Usually it is not significant, but at least you should have a good concept about these concerns. Again, the same concerns or same consideration as a day case. Like you are being asked about dental anesthesia, but you should be thinking about pediatric anesthesia. You should be thinking about daycare anesthesia. You should be thinking about throat pack. You should be thinking about concerns with reference to airway bleeding. So these are the things which you uh, should be thinking. Okay. Mm, okay. So any question or any concern you want to ask? Any comments, please? Tayyab, do you do dental anesthesia? Okay. So
No, sir. No, sir.
another important point I will tell you that usually there is a lot of edema postoperatively. So I strongly recommend to use very good NSAIDs and dexamethasone because it will reduce the swelling, and it will help a lot in reducing the pain. Another thing which I recommend that at the end of the procedure, if you can have simple xylocaine spray, like I have made this a routine that before extubation, I take this simple xylocaine spray, and under vision I spray to the places where they have extracted the tooth. So it will at least give you, because this will numb the area. Okay, so it will give you a good cushion in the immediate post-operative period. Later on, they can have alternative medications for it, but at that time it's a very good way of controlling the pain. Okay. Special care dentistry. So as I told you, there will be the age groups which we can have these problems: severe learning difficulties, anxiety and phobia, severe psychiatric disorders, physical debility and movement disorders. You will have patients with congenital anomalies who have very poor hygiene, bedridden, with cerebral palsy, or even like any neurological problem. These patients will be coming in the wheelchairs. Okay, so you have to be you will have these challenges. Although the surgery is very simple, but you need to anticipate. Okay, so mm, an oral surgery actually is a surgery, and if you have any patient at risk of like infective endocarditis or things like that, that will be a challenge for you. Okay, so any other point, any other comments? Actually, Zishan did not come today. He was asking for this topic a number of times, and even he's not here. Mm, okay. Yes, there is another thing is that there may be they are doing it in a sitting position. You will in the dental, if you are performing dental anesthesia in the dental chair, so it will have the concerns with reference to the sitting position. Okay, so a number of time you need to anesthetize the patient, keep the throat back. How will you how we will manage airway? Sir, I'm sorry, I don't understand the your question, Gopal. Can you speak out? I don't understand your question. You will put the endotracheal tube and then you will place the throat pack. Am I right? Mm, okay. So Zainab, any other point you want to clarify? Actually, we will discuss like MAC MAC monitored anesthesia care sometime, inshallah. Because a number of points, remember one thing. That's why I was telling you that if you have like now, if someone is attending this session for the first time, maybe some of the points you will not be getting. But if you are following me for last 2 weeks, for example, you will appreciate that the journal principles of anesthesia. If you have grip, you will after some time you will think that just imagine that we started recently in last 2 weeks we started from preoperative assessment. Okay, that preoperative assessment you have to consider points with reference to the patient identity. Patient is old, patient is young, patient is pregnant, patient is smoker, patient is obese, and I will consider also hypertension and diabetes because it's so common and so challenging. I will also make it in the list. Okay, so this will be one thing with reference to the patient identity, or you can say patient demographics. So always think about this thing. This will be one point. The second point will be the disease under consideration. Okay, there will be some specific disease or not among the common things. That the second thing will be like, for example, if you have a scenario of a 4 years old child, known case of Down syndrome for adenotonsillectomy. So this is an example that 4 years old child is a scenario of the special placement of the child. So you will think about all the considerations about the pediatric anesthesia. Number two will be disease under consideration will be Down syndrome. Okay, so you will be thinking about what is that Down syndrome is, what is the main pathology, what is involvement of all systems like CVS, CNS, respiration, like all other systems. You can think about it. Okay. And the third thing will be with reference to the surgery. If when you are thinking about the surgery, you will be thinking how much is the risk involved in the surgery, how much is the urgency of the surgery, what position you will have that surgery, how much any critical step in the surgery. Okay. So there will be 4, 5, 6 points which I have discussed. If I will highly recommend you to have a look on the previous recordings, but in the link, it's available with reference to anesthesia planning. Okay, so the number of things which I will discuss this topic. A number of things are common with concerns with reference to the shared airway, concerns with reference to throat pack, concerns with reference to oral bleeding. It will be difficult to evaluate if the patient starts bleeding, and maybe because patient is swallowing the blood, so you don't know exactly. Usually, if there is a drain, you can come to know how much is the bleeding. Okay, if it is like a hematoma is developing, still you will come to know. So but here you don't know how much bleeding is, so you just have to rely on the clinical sign and symptoms. Okay, so this is something common. So again, as I repeat again and again, that pediatric concerns, concerns with reference to the, just now think and consider about each and every step of the anesthesia. Like, how will you induce the patient? How will you maintain the patient? What will be the problem with reference to airway? What are the risk factors with reference to nausea, vomiting? Okay, what will be the risk factor with reference to aspiration? What muscle relaxant you would like to give? What analgesia would you like to give? Okay, how will you recover the patient? Will you send the patient to home? Will you send the patient to ward? Will you send the patient to ICU? Can this surgery be done as day surgery? So if you have a plan in your mind, then things become very easy. Okay, so that's why I will suggest you to make okay. Okay, so uh, this is what I just wanted to tell you. Um Okay, so we discuss about the monitoring standard. We discuss about the in coming sessions. Maybe I will discuss in one session, maybe fluids. One session, we discussed about aspiration in this one, and then we are doing this NORA. Okay, so we discussed ERCP, like endoscopy room, MRI room, dental considerations. So, inshallah, we will do some of the topics like that. Okay. So, I think I will finish here. I will send these articles which I just downloaded with reference to dental anesthesia. Okay, because there are so much repetitions in it. Majority of things which we discuss about pre-medication, how to different options with reference to pre-medication. As I mentioned, you see, midazolam is very bitter in taste, so they can put it in some juice, or they can mix it with paracetamol. I have seen a number of hospitals, they mix because paracetamol will be sweet, cherry flavor or something like that. So what they do in pre-operative, before moving the patient, they give 4 5 ml of paracetamol, and they mix midazolam in it. And by the time the patient will be there in the holding area, he will be sedated. Okay, and then it will be easy for you. Otherwise, you will have to use the gaseous induction. Sometimes they allow the mother parents to go with the patient. In different hospitals, you will find different approach. You can use amla cream. Okay, you can do, as I mentioned, other some other techniques for to achieve the anzolysis. Okay, so airway for extraction of tooth. These are main points I just mentioned to you. Any questions, any points you want to ask or you want to discuss, or if I miss anything, please tell me. Okay, so I will just stop here, and this is some details. Usually in majority of exams, they will not ask you. Okay.
आपने दिखाया तो मुझे पता चला।
Okay, so I'm just having a quick look if anything important which I need to explain to you. Otherwise, you see the same things which I have mentioned to you in one way or other. The same things are coming. Okay. What they are saying, difficult airway predicts risk factors for dental injury. Okay. Because dental injury can occur in any other anesthesia as well, because in all patients you are manipulating the airway and then you will have problems. So here they are mentioning with reference to the dental injury, not specific to dental procedure. So they are telling that what are the risk factors in which you will have more chances of dental injury. Okay, so you see placement of double limit tubes, biting during emergence, suctioning, trying to suctioning while the patient is clenching the tube. Okay, even while pulling out the tube, sometimes the patient clench. Even placement with airway at that time, you can if you try to place airway at the end of the procedure. Okay, then you can have problem. Okay, then any loose tooth or prominent teeth, like you see buck teeth, what you say. So this will, in these cases, you will have more. So they have what you have. They have tooth to blade contact may be reduced with use of alternative blades such as McCoy, a modified Macintosh. They are just mentioning some of the techniques by which you can decrease the dental damage. Okay. Mm. A very important thing is this, that for example, if it happens, you should be, if any, that's why it's a very important part of our preoperative assessment, that if there is any loose tooth, you have to document. Can we give dexmedetomidine in infusion form? Yes, of course. Choice of muscle relaxant. There is no specific choice of muscle relaxant. Actually, with presence of Sugamedex. So actually, I have almost stopped using suxamethonium, and even because, in my opinion, the recovery with Sugamedex and rocuronium is so good that if you have availability, actually there is no replacement to in any patient. Even there is a debate, people discuss that you cannot use in renal failure, but I suggest, my concept is that rocuronium sugamedex mixture is inert, and it is, though it is excreted through the kidneys, but it has does not have any effect. So if it can be used, yes, in the places where Sugamedex rocuronium is not available, then of course cisatracurium is better one. Atracurium is better one, because it will not take too much time for its effect to finish. And even if you have a patient at risk in which you don't want to give reversal, you can just have, if enough duration has been elapsed, actually you can even bypass reversal. Okay, you can check the nerve stimulation, that how much is the blockade, is any chance of residual block. Then like this is what I can comment with reference to your question. Okay, because I have, as I told you, that I am a strong advocate of opioid free anesthesia, that these days, and since many months I have actually stopped using opioids, and I'm using Presidex and very small dose of ketamine, very good use of paracetamol and NSAID whenever it is not contraindicated. Even dexamethasone, it has excellent analgesic effect. You will say that, yeah, we are using it for post-operative nausea vomiting, you are using it to reduce inflammation, but people forget that it increase the quality of analgesia. Even with, when you are giving any block, you mixed dexamethasone with the local anesthetic solution, or even if you use dexamethasone by any route, even if you use IV, the quality of analgesia will be improved. The mechanism, exact mechanism is not known in sometimes, but mainly the anti-inflammatory effect is very important. Okay. So okay, so thank you very much, all of you, for your presence. And I think I have highlighted main points about it. So, inshallah, tomorrow we will continue our discussion about some of the points. Um, I think when Nora, a number of points we have discussed. I was just thinking to have a discussion about opioid free anesthesia, maybe tomorrow or the after tomorrow. Okay. So, thank you very much. Uh, Inshallah, we will meet again. And Zishan, you joined late, I think, but still,
Yes, sir. I just joined, but I'll listen to the YouTube video
yes, and
and then.
any point you want to ask, because we just discussed the main highlights of dental anesthesia, the patient groups, the problems with reference to throat pack, with reference to intubation, with reference to analgesia, with reference to use of local anesthetic with vasopressor and nasal intubation problems. Okay. Any specific
Hmm.
point you wanted to discuss? We can
Just you guys discussed the anesthesia for dental patient in the dentist clinic, right?
in both ways.
Or
Actually, dental clinic
in
with
both?
reference to that one, because there will be again the same concern with reference to the
MRI.
limited resources, out of OR concerns, and here it will be important thing will be sitting position. Okay, because if you are giving
Hmm.
general anesthesia with the circuit like general anesthesia, then the
Hmm.
concern with reference to sitting position anesthesia will be there. Okay, and if you are
Hmm.
using like just sedation, you will have risk of aspiration. You can have local anesthesia toxicity sometimes, because if there is pediatric age group and they are injecting local anesthesia without because in adults maybe this small dose will not cause big problem, but if you are using it in pediatric population without not understanding fully the dose, how much is the safe dose, so then it can
Yes.
then it can create problem. And usually they are asking for hypotensive anesthesia in majority of times, and they are injecting themselves vasoconstrictor. So though this vasoconstrictor is absorbed a number of time as soon as they are injecting epinephrine. Today I had I told you that I had a list of dental day surgery today, and they had a surgery for 4.5 hours. There were 4 or 5 impacted tooths, and they took like anything. And like I had opioid free anesthesia. I gave paracetamol, like this NSAID, and dexamethasone, and a very small dose of Presidex, around 25 milligram of ketamine. Okay, with reference to if you are talking about anesthesia in dental room, the majority of
Yes.
case concerns will be like that. Okay,
Hmm.
so
Right.
okay, so inshallah, we will do next topic tomorrow, most probably tomorrow or day after tomorrow. I will just have a look on some points with
Okay.
reference
Yeah.
to opioid-free anesthesia. Okay.
Right, sir. That will
So
be good.
thank you very much, all of you. All of you are welcome to ask any question even later on, and I will just invite all of you to invite more people. I don't have any personal interest. I just want to spread uh, the knowledge to everyone across, because some of the people are from other countries. I'm sure Dr. Adek Nubi, you are from I think you are from some African country. From which country do you belong, Ashu? Uh, Nigeria. So it's a big honor for all of us. Okay, especially special regards from all people from this part of world. Okay, so you all are welcome. You are my special guest, and you can ask. I am available 24/7 for all of you. Okay, so don't hesitate to ask question to me. Okay, even if you want, if you are following me from Facebook or WhatsApp. So if you are not added to the WhatsApp group, you can just drop a message to me, and I will add you to. Uh, Yes. Okay. So, Zishan, thanks for joining, and all of you, thank you. Inshallah, we will meet tomorrow. Bye bye.